that's kind of, I think, the biggest thing that nurses miss when they're like, "Oh, I just really wanna, like, get out of bedside. I just don't know how to do it. I just don't know how to do it." Make sure you are putting out there your transferable skills. We all have amazing skills as nurses. We have so many skills other than, just your basic nursing skills. You have sales skills, you have communication skills. There's so much we have to offer, and it's like, don't miss out on using that opportunity.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, we're excited to welcome Amanda Kirkland, a nurse who is now a clinical sales liaison. Amanda's journey is one of exploration, growth, and finding balance, both professionally and personally. Her passion for building relationships with patients and providers has driven her to make meaningful impacts in every role she's taken on. In this episode, we'll dive into Amanda's nursing journey, discuss the importance of mental health for women in healthcare, and explore how her role as a clinical liaison has transformed her life. Welcome to the show, Amanda.
Hi, thank you so much for having me. I'm so excited and grateful for this opportunity. I think what you're doing is just incredible. And I wish this was around a couple of years ago when I was starting on my journey. Super awesome that you're doing this. Really appreciate it.
Awesome. Yeah, I'm so glad to have you here and to share your story. And your story is actually a little bit unique in several ways, but one of the ways is because you actually did nursing was not your first degree. So tell us, you were on the path to become a PT. So how did that end up with you becoming a nurse?
I went to the University of Texas as a kinesiology major, super competitive. Everyone in your class was also trying to be a PT. I was working at a physical therapy clinic at the time as a PT tech, and then after I graduated, I became a practice manager of the clinic that I was working at. So I got some really good experience kind of seeing the business side of things, and then I had some really good mentors that worked there as PTs. One of them specifically kind of knew my personality. And as I was applying to PT schools, he was like, Amanda, I think that if I could go back, I would have done nursing. And he was like, I really don't want to like guide you in a different direction. He was like, I want you to do what you are passionate about. But he was like, I think that your personality and knowing the flexibility with what you can do with nursing, he was like, I would suggest maybe looking into that. So yeah, that's kind of how I started in that direction.
Yeah, that's funny. And I mean, like business name is Pivot Path. I think that, everyone's career, expected or not, is bound to have some pivots. And so that was your first one. So it set you down this totally new path. So what type of nurse were you? What different types of nursing roles did you get into?
Yeah, so I went to an accelerated program in Charleston, and then I ended up getting a job in the ER right out of nursing school. So I did a 2-year nursing residency, and then I stayed in the ER for about 4.5 years. I was a travel nurse in the ER realm as well, but I did dabble a little bit in the ICU before I started traveling, which gave me some good experience, just more with the critical patients, and it kind of helped build confidence for when I went back to the ER. So it ended up working out really well.
Yeah. You and I are similar in that way. I started my career in the ER and dabbled, I guess, probably just like my last year that I was working at the bedside in the ICU. Two totally different worlds. And I know that there's always that battle between like ER nurses and ICU nurses. So I always think it's interesting to find other people who have kind of gotten a taste of both worlds.
Yeah, and I'm like kind of a super nerd and I actually like loved the ICU. Like I feel like if the travel money wasn't as good during COVID, I probably would have stayed in the ICU for a lot longer. It was only like a couple months, but I was like, I gotta take advantage of this travel nursing business right now. So that's kind of why I ended up leaving. But I love like the CRT patients and stuff like that and all the math with it. So yeah, that's kind of why I ended up migrating into the travel realm.
Yeah. I mean, the travel pay during COVID was just so crazy.
Chef's kiss.
Yeah, exactly.
Um,
Well, but I know, I mean, the pay was good because the conditions were not. What was
mhm.
it like being a travel nurse during COVID?
Yeah, I'm glad you asked. So that was kind of a part of the whole so I'll back up a little bit. So before travel, I was like really starting to feel that like impact that it was having on my mental health. So I took a couple travel contracts close to where I was living and then I ended up taking one in New Mexico, which was like the biggest bright light in my life. I mean, when I went out there and traveled, that was kind of like the first time in a while that I truly felt like alive again, just because the COVID conditions were so like the pace was really quick, in the ER. We were, I mean, honestly, treating a lot of like we had a lot of codes. I mean, the one thing that kind of flipped the light switch on for me was when the morgues were full and yeah, it's really hard to talk about. So the morgues were full and we like didn't know where to put people. And that was kind of when I started thinking, okay, like this is my time to start building up my brand and like moving into something more like medical sales related. But I knew it was going to kind of take some time to get myself to the point where I felt ready to jump into something like that. So while I was traveling, I was kind of working on like my health and, just making sure that I was like preparing myself for a role like that.
Yeah, so it's interesting to me that you kind of had that foresight of looking ahead to like medical sales and saying, hey, you know
Mhm.
what? Like, that is something I'm interested in. How did that even really come to be on your radar? A lot of nurses like don't really always, it's not easy to see that path into a non-bedside role. So how did that come to be for you?
Yeah, so actually it started when I was working at that physical therapy clinic before I started decided to go to nursing school. So I was kind of looking at once I decided I didn't want to do PT, I was looking at other jobs and most of the medical sales jobs that I was interested in required 5 years of sales experience, like business to business sales experience or 2 years of nursing experience. So then I knew that I had a bachelor's degree and there were some accelerated nursing programs that were only like 16 to 18 months. And I was like, I can do anything for 16 to 18 months. Like, bring it on. Kind of have like one of those Elle Woods moments, like, lost them what? Like, it's hard. So I was like, nursing school? What? Like, it's hard. So yeah, I went and I finished. And then while I was in nursing school, that's kind of when it all clicked. And I was like, this is what I'm supposed to be doing. So it's a very interesting way that I got into it. So I kind of had that knowledge of that I'd eventually probably move into clinical sales or medical sales later.
Yeah, that's interesting. And do you think that changed your perspective at all on the skills that you were developing at the bedside and how those could be applied? I ask because I think that nurses obviously have a ton of transferable skills that they develop at the bedside, those soft skills that are so essential. But I
Mhm.
think if you've never worked away from the bedside and you've only used those skills in like a very clinical context, it's hard to imagine how those apply out away from the bedside. A lot of
Mhm.
nurses, I'm like, oh yeah, you are like great with interpersonal skills, building relationships, getting buy-in, working well under pressure. And as you say it, nurses are like, oh, yeah, obviously. But it's
Yeah.
like as you're going through those motions at the bedside every day, it doesn't always like click like, hey, this could also make me really good in another type of role. So knowing that you wanted to end up in medical sales, do you think that you looked at your day-to-day like nursing experience through a little bit of a different lens?
I think I started looking at it that way more towards the end of travel nursing. So, as you're thinking about what interview questions you might be getting thrown when you're applying for these positions, right? You're starting to think, okay, how are my skills transferable, right? So, when you're at bedside, you are selling. You like cuz in my interview for this position, the clinical liaison, they were like, "Tell me about a time where you have had to sell." And I was like, "Well, every single patient that you're going into, you're selling yourself as a nurse, right? You're dealing with lots of different personalities, lots of different situations. You're dealing with family, you're dealing with, different doctors. You're having to sell your skills and your services to build trust, right? And that's kind of the same way that you go about it when you're in a clinical sales role. You're selling yourself and building trust with that person that you're trying to sell something to, but really you're not selling something, you're selling yourself.
Yeah,
Anyway.
yeah.
Yeah.
And like the plan of care that you're like basically proposing to them, right?
Mhm.
Like you need them to trust you so that they will buy into this like, okay, yes, like we need to do X, Y, and Z here in order for me to,
Yeah,
achieve an outcome, which is in their mind, get better, get out of this hospital.
exactly.
Um, so yeah, that's interesting. And so a lot of people in the audience listening may not even really understand the like kind of environment of medical sales and like what your day to day as a clinical liaison might
Yeah.
look like. So can you kind of just give us an overview of your role and responsibilities?
For sure. So I'll kind of start with I work for an infusion pharmacy. So let's talk about what that is first because people might not know. So infusion pharmacies are pharmacies other than your like main pharmacies like Walgreens or CVS. So they specialize in compounding and mixing medications like anti-infectives, total parental nutrition, so more of the acute patients, but then also they service like chronic patients who might have Crohn's or colitis and they need to start with infusions and then they go to an injectable medication. So, my role as a clinical liaison. So, when you think about what a liaison is, right, you're kind of a middleman between two things. So, I am a nurse that coordinates between the patients and the pharmacy. So, I've actually been in two different calibers of clinical liaison roles. So, if you want me to kind of jump into the first one.
Yeah.
Okay. So the first one that I had, I was in for almost 2 years, so about a year and 11 months. I recently transitioned into something else, but I was called an acute clinical liaison. I supported the acute infusion pharmacy here in Colorado. And essentially what my role is that or was is that I would go to all the hospitals in Denver when a patient was being discharged on IV antibiotics or TPN. So, what essentially happens is a case manager sends a referral over to us. I'm partnered with a sales rep, so I'm kind of an extension of a sales rep. I'm the his clinical counterpart. And I go to the hospital, knowing that the patient's about to get discharged. And essentially, my role is to assess the patient, make sure they're appropriate, educate them on how to infuse the antibiotics or TPN through their PIC line, educate them about PIC lines, and make sure that they're safe. So, part of that assessment is what's their mentality, what's their dexterity, if they can't do it, do they have family, that's going to be involved. So there's a lot that goes into it and honestly it's so rewarding, especially here in Colorado because we have a lot of rural mountain patients who we're their only resource. Like they can't get nursing out where they live. There's not an ambulatory infusion center they can go into. So we're kind of their sole education source and their sole contact. So I honestly found that it was so rewarding in that role. It's also very challenging. It's very competitive because you're up against other infusion companies. And with that, there are metrics that you have to meet as a clinical liaison. So it's based on the number of medications that you fill for the month. There is a nice little reward each year. So if you are one of the top performers nationally, you get to go to President's Club. So last year I actually won President's Club and I got an all expenses paid trip to St. Kitts, Caribbean, me and my boyfriend for 5 days. It was incredible.
Amazing.
So it's a good opportunity and to really like jump in from bedside to sales. I really think it's like the perfect transition to kind of prepare you for more higher caliber sales roles later because really when you're going in and you're teaching these patients, like I said, you're selling yourself by building trust with that patient and that case manager. And so, really, the selling part comes natural, right? Because you're just being yourself and you're offering good service to the patient and making sure that these hospitals feel confident that the patient's, going to go home and be safe and not be readmitted and, there won't be any other complications. So, that was kind of that first role. Kind of long-winded, but that's pretty much the extent of the acute clinical liaison.
Yeah, and I think that you're so right. That is such a good kind of bridge position between
Mhm.
nursing and like the medical sales world. Because I mean, we educate our patients on their medications, like discharge plan and everything every
Mhm.
day at the bedside. So, getting to apply that in just like a bit of a different environment is awesome.
Mhm.
And man, don't I wish that patient education at the bedside came with President's Club
Yes.
rewards like it does in your world.
Yes, yes. Yeah, I had a goal. So, like, really anything I step into, I try to set a goal and meet it. Sometimes it doesn't happen, but that was my goal. The first year I was eligible, I was like, all right, we're doing this. Like, so I really did put in a lot of time and, hustled around Denver, put a lot of miles on my car. But I mean, it was incredible. And I learned so much within that year of, working to meet that goal. So,
Yeah, absolutely. And so tell us about the next one that came after that.
yeah, so there was a market change, and essentially they pulled the acute infusion part out of Colorado specifically. It's still in other states with the company I'm at, but they transitioned me naturally into a biologic liaison role. I got lucky and I still support the same reps. And like I said, we have a good relationship. So it just kind of like flows really nicely. And essentially, what I do now is I work more on the chronic side. So I was on the acute side with like antibiotics and TPN. And then now I service more of the chronic patients with like rheumatoid arthritis, Crohn's, and colitis type medications. So essentially, these GI offices or rheumatology offices will send referrals over to us. And I actually work remote now, so no more driving around. So
Nice.
kind of got lucky with that. And so what I do is when the referral comes in, I look through the clinical, I look at the labs and make sure, they have appropriate labs and clinical for the prior auth process. And I just kind of monitor what you call like the workflow that pushes the patient through from the initial referrals that we get all the way through when they get scheduled. So I'm kind of the, again, liaison, the middleman that makes sure there's no hiccups or anything like that. So it's pretty cool. And I think it's awesome because, say, we get a referral from a doctor's office and the patient's symptomatic. And normally the process, with biologics is that it can take, quite a bit of time to get that PA approved or get them to the first day that they're scheduled for their infusions. So I'm kind of that like bulldog that's like, hey, we got to get this moving. Patient's not feeling good. I talked to them on the phone earlier. They need their infusion by next Friday. So it's super rewarding in that component that we are making an impact on these patients by getting them infused when they need to be. So
Yeah,
yeah.
absolutely. I love that again and again in these conversations, nurses talk about, they found this non-traditional path, but they talk about the impact that they're still able to make and the fulfillment that they get through their work. So I think that is really unique about nurses in general, we want to make an impact through our work. So it's really
Yeah.
cool just to see all of the different ways that you can do that. And so I want to talk some about how this career change has kind of impacted your life, because obviously work is not everything. That comes with a work-life balance. So what are some of like the major ways that this career pivot has, you know, just impacted your life in general, whether that's mental health, your overall work-life balance, personal growth? I'll let you kind of choose where you want to jump in there.
Yeah, so I guess we can start with mental health because, that's always a fun topic. Just with COVID, like, there was a point where I, like, just honestly kind of felt, I know it sounds dramatic, but I just felt, like, dead inside. Like, I was, like, getting home from work, and I listened to one of your other podcasts, and the girl was just talking about, like, she just dreaded, going in to work for her next shift, and I just remember sitting in the car, and I was like, "Oh my gosh," I love what I do, but I feel like I'm just in this constant fight or flight state where I like can't ever really like decompress. I can't, like I'd never feel rested enough. Like even though I was only working like 3 days a week, I just felt like tired all the time where like I didn't want to do the things I love. And I just was like, okay, it's time to like slow down. So when I started this role, I really made an effort. Like it's 9 to 5, Monday through Friday. So I was like, when I get off, I'm going to work out. I'm going to prioritize, like listening to inspirational podcasts, things that are going to help me hype myself up to go out there and hit my numbers, and I was able to go hiking on the weekends because I had more energy and, my boyfriend and I were social butterflies. So, I was able to get out there and really start like living again and not feeling like I'm in this perpetual fight or flight mode. I'm sure you can relate.
Definitely. And I can't remember, I was talking to somebody just this week, I think, about kind of the chronic versus acute stages of stress, and
Mhm.
how after you are burnt out for a while, you kind of leave that acute phase of stress and you enter this just like chronic phase of stress,
Mhm.
which can be harder to recognize. I mean, the things that you're talking about of just like, feeling drained of your energy and not doing the things that that really like light you up anymore. Like all of these are just kind of like more subtle symptoms of stress. And I think that allows for nurse burnout to go unrecognized for longer once you enter that chronic stage. And I really don't think it takes you long to get there as a nurse because you're doing it every day.
Mhm.
And every day you go to work, you are facing like this. I mean, the 12-hour shifts that we go in for are physically, emotionally draining. And so, yeah, I think that recognizing nurse burnout is one thing, but I can also relate to the like feeling dead inside. Like I think that
I
that can come that
yes.
can come with that like chronic phase of stress too, of just like ugh, like what is it? Like I don't have my like light or my spark anymore.
Mhm.
So I think that it's great that you even recognize that, because I think that even can be hard. And so then, yeah, switching from that 3 day a week schedule to the 5 day a week.
Mhm.
At first, I was like, I don't know about this 5 day a week thing. Like as a nurse, I would have like died on the hill arguing that 3 days a week is definitely better than five.
Yes,
But
yeah.
then once I got into the 5 days a week, working remotely with like the work life balance that comes really just outside of healthcare, I realized, okay, so when I close my laptop at the end of my workday, I have hours left in my day, like the whole like late afternoon, evening. I have the
Mhm.
energy to give so I can spend it with my spouse or friends or like going on a hike or a mountain bike ride or whatever.
Yep.
And realizing like, oh, okay, like yes, I'm working 5 days a week, but I have time for me on
Yep.
those 5 days, and to like be the person who like be myself and like take time for myself. And I think that is something that as nurses, when we're working those 3 days a week, you don't have time for yourself. You don't have
Mhm.
energy for yourself. And then you get to your day off and you're like, I'm still drained. Like I still
Yeah.
don't have energy for myself.
And I think you kind of like, I mean, I hate to say it, but I feel like I kind of made nursing my whole personality for so long. And then once I transitioned into this, I was like, who am I? What do I enjoy? What do I want to do? Like, what's my brand, right? Like, I'm not trying to build a brand, but like with yourself, you should build a brand. Like, you should know what you are passionate about. But when you're in a state of perpetual tiredness all the time, it's hard to kind of like care about that, right? So like this really allowed me to hone in on like who is Amanda? Like what does Amanda want with her life? What is she passionate about? Like, and for me, I realized it's like holistic wellness, skincare, and just all those other things that like kind of come along with like when you like truly start to work on yourself, it's like such an incredible feeling.
Yeah, absolutely. And I'm so glad that you brought up the tie with your identity that you kind of
Mhm.
had with nursing, because I think that is so, so common with
Mhm.
nurses. Like, I think that more so than many other professions, if not any other profession, we as individuals tie our identity to being a nurse.
Mhm.
And on one hand, that's a really beautiful thing because we pour ourselves into just like being there for others to like get
Right.
them through that time of stress. And for a lot of us, it's what we're passionate about. But I think that what's important there is realizing that nursing is not all that you are.
Mhm.
It can be like, I'll always be a nurse. You'll always be a nurse. I will always be an important part of us, but it's not everything. And so I
Right.
think
Yep.
that recognizing that and that like we're not just like martyrs to our career, like there's things that's important for us to take care of ourselves and our families and pour time and energy into that as well is just really important to recognize because I mean, I had like it sounds similar to what you're describing, but I feel like I had a like slight identity crisis when I decided to leave the bedside. So yeah, it was like figuring out like, okay, who am I? What do I like doing? And how does my career fit into that? And what does like Audrey as a professional, whether
Mhm.
that is like at the bedside as a nurse or doing whatever else, like what is my professional identity? And so yeah, I think that recognizing that we are professionals, like yes, we're nurses, but we're also professionals and we have skills that can be applied and like many other things is just a really important realization, and also the realization that it's okay for us to make some decisions for ourselves and
Mhm.
for what's right for us and our families. And sometimes that means a career pivot and leaving the bedside and doing something different. So,
Yeah.
and then I know that you also like you found this new work-life balance, you're able to work on yourself and, and start enjoying the things that are important to you again. And then you also are getting your MBA. Is that right?
Yes. Yeah. So that's going to be the next thing. Yeah. So I am very fortunate. My work actually partners with Capella University. So I'm actually able to get my MBA completely covered. There are some stipulations with like staying with the company, but I am about halfway through. I started last November. So just kind of going at my own pace. And it's been so rewarding. Knew that I would probably use it for a different role in the future. But honestly, it's been really eye opening and I'm like able to apply it to my personal life with, just improving certain things here and there. It's been a really good opportunity. And I would highly recommend, like, for any nurses at the bedside that are looking for something different, look at these companies that offer tuition assistance. Some of them will match it fully, like mine. Some other companies will give you a certain amount per year. So it's whatever you're willing to work with. But yeah, I'm super thankful for this opportunity. It's been really nice to be able to, be on like a flex path and work on it, certain days of the week when I want to. And you essentially have like 12 weeks to complete a class. It's really nice. So yeah.
That's incredible. I talked to a nurse a few episodes ago, Zach.
Mhm.
He left the bedside and actually now he is in the world of finance.
Oh,
And
nice.
he found a company who like fully sponsored all of the like education that he needed to pursue that. And I
That's awesome.
think that the real takeaway here is that like don't shut down a like path or an opportunity for yourself because you think that like getting additional education or whatever is a blocker, whether that is like a
Mhm.
time or financial commitment. Because I think that there's still like just because like you might need a different degree to go down a specific path, there's usually a way to get that is like not prohibitive, like, whether
Yep.
it's a company sponsoring or some sort of scholarship or whatever. And I think too, like in a lot of these cases, you don't necessarily need that degree to get your foot in the door. Like you can
Mhm.
get your foot in the door kind of like you can get your foot in the door, you can start working a specific role and you can take advantage of those opportunities to get additional education, certification, whatever it is. But a lot of these companies do invest in the professional development of their employees.
Yep.
And so, I don't know that I actually ever like fully fleshed this out in my mind when I was thinking about it, but when I was at the bedside and like kind of thinking about the different paths that I could go down, I would always kind of get to this spot in my head of like, well, I would have to start over. And like,
Mhm.
I don't know if I even like fully fleshed out what starting over really meant.
Yes.
But in healthcare, you need a specific degree, license, certification to do any job that you're doing. And that's like a requirement to like start. And I think that what's important to realize is like, it's really not that way in a ton of other positions. Like
Mhm.
you can get started down any number of paths without having any extra degree, certification, training. And if you need that along the way, generally there is some support from the employer to help you go and get that.
Yes, it's all about how you market yourself when you're applying for these roles. You wanna make sure that if you have an ER background and you have infusion experience, make sure you talk about that when you're applying for an infusion role. If you are looking for, like, an oncology sales job, make sure you talk about your oncology experience and how you can how you have those, like, transferable skills, right? So that's kind of, I think, the biggest thing that nurses miss when they're like, "Oh, I just really wanna, like, get out of bedside. I just don't know how to do it." That's the biggest thing I see online, right, with these, like, travel groups and, Instagram. "I just don't know how to do it." Make sure you are putting out there your transferable skills. We all have amazing skills as nurses. We have so many skills other than, just your basic nursing skills. You have sales skills, you have communication skills. Like there's so much we have to offer. And it's like, don't miss out on using that opportunity.
Yeah, absolutely. And I work on nurse resumes all the time to kind of take them from that like very clinical bedside experience to
Hmm.
something that works in other roles. Cause you know how it is when you're applying to a nursing job, it's like, well, I worked at a magnet facility with 500 beds. It was a level 1 trauma center, and I'm good at managing ventilators and drips and like IVs, like all of these things that are very, very clinical. But
Hmm.
if you like peel back that like very like tactical clinical layer, all
Hmm.
of your soft skills that you're working on every single day are right there. So it's just like, like med surge nurses, any med surge listening to this podcast, like you are used to like managing priorities and like priorities that are constantly shifting between the like I don't know, 8 patients, 5 to 8 patients that you're taking care of on any
Hmm.
shift. And you can delegate tasks and, utilize your resources effectively. And there's just all of these things that go into every single nursing role that you're right, they make us fantastic candidates away from the bedside.
Yeah.
And I don't know about you, I mean, but there's still, I mean, clearly this is applicable to you because of just the nature of the role that you're in, but I can take what I'm doing every single day, even now as an entrepreneur. I can look at what I'm doing every single day, and I can look back to my nursing career and think like, oh yeah, like this is kind of where I like built and developed this skill that I'm using
Yep.
today, which is
Yeah.
cool.
Yeah, I mean, like, we are selling yourselves to each patient, like I was saying earlier. And like in my interview, they were like, I know you don't really have much sales experience, but tell me about a time that you've had to sell. And I was like, well, have you ever tried to convince someone in like a manic episode to give you their blood? Like that's sales. Like you have to really know
That's probably a harder sell than many salespeople have ever experienced in their career.
Yes.
Oh man. Okay, well, we've thrown out a lot of like really good advice just in the last few minutes on communicating your skills that you develop as a nurse and how they apply into other roles. What other advice or words of wisdom would you share with anyone listening today who is, at the bedside and maybe just kind of starting to consider some non-traditional paths?
For sure. I think my biggest piece of advice is don't take advice from people who aren't willing to do what you're willing to do or go where you're willing to go. That is the one thing that has really stuck with me that I heard a few years ago.
I love that.
Yeah. Because sometimes like you'll get advice from people and you're like, but I would try that. You know what I mean? And don't sell yourself short. If you are scared to do something, try. Just try. Just go for it. If you're given an opportunity, sign up for it and challenge yourself, right? So like, or if you see an opportunity, sign up for it and challenge yourself because it's only going to help you. Like, knowledge is power. It's only going to help you build more skills, build more confidence. I mean, one of my goals this year was to speak in front of a large crowd. And then when I saw your post, I was like, you know what? Challenge accepted. Like it's a little nerve-wracking, but let's do it. You know what I mean? And I'm so thankful for that. So really just don't sell yourself short. Challenge yourself, step up to the plate because it's only going to be a positive learning experience for you in the long run. And then I do have a quote if you don't mind.
Let's hear it.
I'm a big quote girly. So I love this girl. She's on Instagram. Her name's Brianna Wiest. And this quote really resonated with me. So it says, I hope you allow your life to be more than you ever thought it could be. I hope you press back on the limiting thoughts that have made you cling so tightly to the world you have already outgrown. I hope you will listen to the little calling in your heart that knows what's really true, even if your mind doesn't yet understand how it might be possible. I hope you will consider that maybe there's more available to you than even you know to ask for. I hope you will let yourself be expanded to see that there are others just like you taking big leaps in the directions you always hope to go, but have been waiting on the courage. So I just love that because it just resonates so much with what I've been through.
Absolutely. And that really resonates with me and just even with what I hope that this podcast can be for people. Like I want to bring nurses like you on to share like what you're doing and what you're accomplishing, because I think that sometimes within the nursing profession, that viewpoint can kind of be limited. Like it's not like when I was in nursing school and working at the bedside, I wish I had been able to tune into a podcast and hear about all of these nurses that were doing a million things out there and just kind of open my eyes to the paths that are available to me. But yeah, that's really powerful. Our nursing career is super valuable. I don't think we should take anything that, we are doing or have done for granted. And I think that message on just adopting a growth mindset and not being afraid and just kind of relentlessly pushing forward, always learning, always looking for new opportunities. Being a yes girl when it comes to new opportunities is just kind of the key to success in some ways.
Yeah, and even if it's uncomfortable, that's good. That's a good sign. That means that you are like, take it on because that means you're ready to grow and challenge yourself into something different. And then you'll look back later and you'll be like, I can't even like believe that I was ever scared of trying, X, Y, Z. And then it'll just be so natural that you're going to want something else to try and something else to work towards or grow towards. It's just really cool to look back hindsight and be like, oh my gosh, I did that,
If you'd like to connect with Amanda after today's show, you can follow her on Instagram at hike2enlighten. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, visit the job board at jobs.mypivotpath.com. And if you have any questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and we'll see you next time.